Green poop. Green stool often appears when digestion is moving faster than usual. Bile naturally begins as a green fluid before changing color during its journey through the intestines. If food passes too quickly, some of that green color remains visible. Leafy vegetables, green food dye, or certain supplements can also cause it. In many cases, it is temporary and harmless. Red poop. Red stool is sometimes caused by foods with strong natural coloring, especially beets or brightly dyed snacks and drinks. But a bright red color may also come from fresh bleeding near the lower digestive tract. Small tears, hemorrhoids, or irritation are common causes. The color usually looks much brighter and fresher than darker forms of blood seen higher in digestion. Brown poop. Brown stool is considered the normal color for healthy digestion. The color comes from bile, a fluid made by the liver that helps break down fats. As bile travels through the intestines, it changes from yellow-green to different shades of brown. The exact tone can vary from person to person, depending on diet, hydration, and digestion speed. But brown is usually a sign that the digestive system is working normally. Blue poop. Blue stool is rare and is usually connected to heavily colored foods or drinks. Bright candies, frostings, slush drinks, or snacks with strong blue dye are common reasons. Natural foods like blueberries may slightly darken stool as well, though usually not as vividly. Because blue stool is uncommon naturally, it often traces back to something recently eaten. Orange poop. Orange stool is commonly linked to foods rich in orange pigments, especially carrots, pumpkin, or sweet potatoes. Artificial coloring in snacks and drinks may also change stool color temporarily. In some situations, orange stool appears when bile is not mixing normally during digestion, which affects the usual brown coloring process. Black poop. Black stool can appear after taking iron supplements or certain medications that darken digestion naturally. Some dark foods may also contribute slightly. But stool that looks deep black and tar-like can sometimes signal bleeding higher in the digestive tract, where blood has had time to darken while moving through the body. That appearance is usually very different from ordinary brown stool. White poop. White or clay-colored stool can happen when there is very little bile reaching the intestines. Since bile normally gives stool its brown color, the absence of it can leave stool looking pale or chalky. Some medications may temporarily create this effect, but if white stool keeps appearing, it is important to see a doctor